our hospitals, we made a decision that we were not going to reduce the funds that are in our state hospitals right now. We decided that we were going to take our reductions for programs that were not yet implemented, that we would reduce programs that were pilot programs or programs with limited coverage throughout the state before reducing statewide services. One of the commitments that we made to you about 4.5 years ago is that there were many counties in Georgia that had no capacity to provide services, particularly in the area of mental health and addictive diseases throughout the state. And so we decided if we were going to have to take cuts that the last thing that we wanted to touch was the capacity that we had developed to provide basic services throughout the state. And then when we talk to you about basic services, we are talking about medically necessary services. So we did not want to cut things like doctors, nurses, medication, and therapies. So those were the things that drove our decision-making process as we went through this. This revised budget for FY10 contains $7 million that are additional reductions for our division. And while the revised budget gives us the amount to be taken by program, what I'm going to do today is propose some slight changes to that. The reason that we are proposing slight changes is that we want to reduce the impact on people receiving services as much as is possible. So what we did in determining this last round of reductions was look at what the previous reductions had been and where they were taking with an eye towards equalizing the impact across all of the disabilities. So before we had to take the $7 million, when we looked at the reductions taken broadly in terms of addictive diseases, mental health, and developmental disabilities, clearly addictive diseases had been the most heavily impacted. They had had about a 24% reduction across the state. We looked at mental health, had had a 10% reduction, and developmental disabilities had had a 4% reduction. So when we look at this $7 million and we have to equalize the impact, that's what's driving this. Based on this information, then we knew that addictive diseases cannot take any further reductions. So we knew that it was going to have to come out of mental health and addictive diseases. So when I give you our variations from what is in your document, I wanted you to know that so you could understand what we're recommending. The items in the 09 amended governor's budget that are not included in the FY10 governor's budget is you will not see the CSB Employee Retirement System holiday. That was a $6.8 million one-time savings taken in fiscal year 09. You will not see a $4.6 million one-time savings that we took in FY09. That was the fact that the community services that we're bringing up in Columbus and Savannah did not begin until November 2008, and so we took those first few months as a cut. And then, of course, we have no furloughs that are currently included in the FY10 proposal. So those are the items that are not included. Now I'm going to walk through the tracking sheets with you in the program areas. If we'll begin on page 4 with adult addictive diseases. Item 26.4.5 is to defer funds for Hope House provided for in 2009. And I want you to understand, I'm going to tell you the item and then kind of tell you the explanation or the impact of that. That eliminates new funds for adult substance abuse residential provider. They still have a contract for $863,000. That simply eliminates the new funds that they received in 09. Item 26.4.6 reduce new provider training and quality compliance audits. That is a reduction of our contract with APS, who do a lot of our training and quality audits. It's about a $1.5 million cut across programs. This is the adult addictive diseases portion of that. What we are doing as a result of that is suspending some provider training, and then we are decreasing the number of audits of our providers. What we're going to do, rather than just say every provider gets audited a certain number of times, is we're going to say that we're going to focus our attention on those providers who provide the most services or who are problematic in some way. 26.4.7, we're reducing various contracts. That is a 1% reduction. The total of that is, the total cut across programs, again, is $2.8 million. This is the adult addictive diseases portion of that, and it will impact 115 providers. 26.4.8 is a TANF reduction. That was a reduction of about $4.3 million in federal funds. It eliminates 300 outpatient slots and 42 residential slots. These are primarily women and children.
Could I get a little bit more, well, why was this offered? This is federal funds. I mean, this is not, I don't understand why. This just doesn't help us in this current budget crisis necessarily, unless this was needed to come out of TANF to go fund some other hole somewhere else. I mean, do you have a little bit better explanation? I mean, because that doesn't seem like a, I don't know. I'm just going to tell you, I don't necessarily agree with that move right there.
The TANF reduction here in our program, we get our TANF dollars from Department of Family and Children Services, and they allocate. We get a portion of them for this purpose. Public Health gets a portion of them for some activities, and then DFACS has their own activities for this. As they've learned, as they are earning less TANF dollars, then they are having to pare back their spending. And this is one of the areas where it's been pared back. We are the provider for them of this service. And so this is a cut that's a reduction, not as a result of our budget cuts, but as a result in decreased earnings in the TANF area.
Okay. Well, we'll talk about that later. Continue on.
26.4.9, that's a 5% reduction in adult addictive diseases, core and specialty services. That will impact approximately 675 people. 26.4.10, that is a reduction to supported employment funding. This $301,000 is the addictive diseases portion of a $4 million cut. This eliminates all supported employment funds for people with addictive diseases or adults with addictive diseases. What we do have is $2.7 million in federal mental health block grant funds that we have available to try to minimize the impact of this. What this does is it removes the state dollars, not the federal dollars. 26.4.11 is a reduction of funds for consumer and family assistance. This is funds that are available for both adult mental health consumers and adult addictive diseases consumers. It is an $882,000 cut. Of that, this $119,000 is the adult mental health portion, the adult addictive diseases portion of that. 26.12 .4.12 is discontinued funds for opioid maintenance therapy. This is methadone treatment. This cuts all state funds for methadone from indigent client programs. These programs serve about 1,000 people annually with state funds. Going forward, we're going to use state substance abuse block grant funds to provide services for about 500 of these people.
So we're going to lose half the capacity with that cut.
You are going to lose half the capacity with this cut, and we're going to offset it with federal block grant funds. 26.4.13 is a reduction of funds for United Way Regional Commission. This is a total reduction for them of $150,000. This is the adult substance abuse portion of that cut. The impact is 44 homeless persons with mental illness and or addictive diseases will lose case management services. .4.19. This is a change from the 09 budget. This is a reduction in funds for methamphetamine addiction services. This eliminates a program that is serving 17 meth-impacted counties and about 138 consumers annually. It is a larger cut than fiscal year 09.
So what's left in that program?
What's left in this program, this eliminates the program.
It eliminates it. So we've decided that we don't have a meth problem anymore. Just asking.
May I ask a question?
Yes, you may.
You said 17 counties and 138 people?
Mm-hmm.
Are those counties all metro counties, or are they North Georgia? Or
That is northwest Georgia. Those were counties that we identified when we were determining meth-impacted counties. We worked with GBI on their arrest data and defects on what they were seeing coming in through their offices to identify the counties. .4.15 is a cut to the crisis and access line of $61,000. The total reduction across all programs is $268,000. So this is the adult addictive diseases portion again. And this reduction means that they're going to lose about 7 of the people that answer those phones for them. And so what you face with that, without as many people answering the phones, is that the time it takes you to answer the call may take longer.
Do you know about how many, the staff that you have? I mean, you haven't, just generally, it doesn't have to be exact, I'm just kind of curious. How many people are typically taking calls at any given part of the day?
I do not have the number that they have at any particular time of the day, but I can get that because they're a contracted provider. And so what we monitor them on is how fast do you get the call answered, whether you do it with one staff or 10 staff. And right now they answer in about a half a minute.
it's less than a minute?
Mm-hmm.
Well, what kind of phone calls are they taking? I mean, are these people that, maybe experiencing a breakdown, or is it like, people suicidal? I mean,
All of the above. They either are just looking for resources in their local area that they could go to, because what makes our line a little bit different than others around the country is the fact that we'll actually make your appointment for you on the line. If you call us and you want services, then we have the providers lined up. We'll make the appointment. We can tell you who is closest to you, who can get you in the quickest. They'll also take people who are in crisis, triage those. They take calls from sheriff's departments. They take calls from judges, from schools. They're set up to be the single place, not the only place, because you do have other providers that do 24/7 numbers for access to their services that are well known in their local communities. What we were creating with BHL was the ability to have one line with all certainty that anybody in Georgia could call and get services.
Okay.
And then 26.4.16 is $12,000, and it eliminates the new FY09. That was the only money there was for them, and so it eliminates that $12,000 for them. And they are a substance abuse provider in southeast Georgia. So that finishes up addictive diseases. Any other questions about? So you can see that they were heavily impacted.
What about the Marcus Institute?
I'm going to talk to you about the Marcus Institute under Children's Developmental Disabilities. That's where we have that information captured.
Okay, thank you.
Next, we go to adult developmental disabilities. The first item is 26.5.1. We'll skip those 1, 2, and 4 because those are the things that you already know about. 26.5.5 is a reduction in funds. It is a total, what the tracking document tells you, this is where they put in their suggestion for that $7 million, and they suggested that we take a $2.9 or $2.8 million cut in this area. We are proposing in this area a $3.3 million cut in this area, so a slightly higher cut in this area because we knew we could not take cuts in addictive diseases.
Okay, you state that one more time. 3 point what?
3.3.
Okay, what's the impact of that 3.3?
Here's what we did. We took Rockdale Cares, which is a respite provider for people with developmental disabilities. That eliminated a contract with them for $50,000. We took Oral Health Care, that's a $50,000 contract, and we gave it up. That program currently serves 173 dental hygienists. It's difficult sometimes for people with developmental disabilities to go to your traditional dentist in the community. So this was a program to train hygienists to serve that population. We gave up that $50,000 contract. We gave up $3.2 million in other contracts in this area, which equated to $3.3 million. And I can give you a breakout of what those other contracts are.
I think you just get it to Chase.
Okay, because basically what we're telling you there is we were giving up a lot of specialty contracts that were available in a particular area of the state to avoid giving up those core services that are available throughout the state. Was not an easy decision, has nothing to do with whether the programs were good or not. It was just our value placed on maintaining core services as much as is possible. Item 26.5.6 is related to stimulus dollars. These are the replacement for state Medicaid match with federal funds, and that's $31 million. So we expect to draw that down. This is...
If they ever change the rules, that's a big hole to have to fill back up.
Mm-hmm. Yes. 26.5.7, we took in adult developmental disabilities a $401,000 cut, reducing training. Basically, this training was going to our community service boards, our regional planning boards, but it also eliminates consumer and family education as well as self-advocacy training for about 748 people. It also eliminates training of court personnel for about 80 court personnel who get trained in issues specific to people with developmental disabilities and their representation in court. So we do training of lawyers and such in the court process. 26.5.8 is a TANF reduction. It eliminates all TANF DD dollars, that's $411,000 federal dollars. The impact of that is it eliminates job readiness training for about 50 people. 26.5.9 is money follows the person. This is an addition. It is a change. It is an addition. It provides for 150 6-month waiver slots. It's 1.9 or $2 million.
Are they all kinds of waivers? Are they all different kinds of waivers or just mental health waivers?
These are all waivers for people with developmental disabilities.
Okay, DD waivers.
And what this is the money follows the person is the money that allows us to move people, transition people from the hospitals into the community, and is part of our agreement with the Office for Civil Rights. 26.5.10 is a reduction in motor vehicle purchases. That's roughly $1 million. We have not been expending money on vehicles. Basically, what we've done is taken that money and purchased transportation for people as opposed to purchasing vehicles. So the impact of that will be less transportation. 26.5.11 is annualizing the cost of 365 waivers. That's $2.5 million, and that is a change from the FY09 budget. That is an addition. $26.5.12 is reducing funds for 135 vacant MRWP slots provided for in FY 2009. Basically, what we did is eliminate 135 of the 500 waiver slots funded in FY 09. And what we are doing with that, they're reminding me over here, what we are doing with that is we have about 340 waivers that come available every year, that turn over every year, where someone either passes away. It's not likely that they're going to not need services, but typically passes away, moves out of state, and so it's the attrition. So we're saying that we could take that 135 as a cut, and then we will still provide the 135. We'll just use our attrition to be able to do it.
But it'll still be, excuse me, it'll still be 135 less slots.
Yes, that's true.
And that if they existed, you could use them, correct?
If they existed, we could use them. We have about 6,800 people who are waiting for waivers now.
Okay. Did you have a question?
No, she answered it.
Okay.
26.5.13, this eliminates, this is another cut to oral health care, and this is the remaining $50,000 that is in their contract. So this eliminates their new 09 funds, and this is the hygienist program that I talked with you about. 26.5.14 is a change. It replaces state dollars for the 3% provider rate increase. 26.5.15, the total, this is the federal match. The total reduction across programs is roughly $2.8 million. This replaces state dollars with federal funds due to the increase in the federal participation. 26.5.16 is the adult developmental disabilities portion of the cut to the crisis and access line, which is $13,000. And then 26.5.17 is a reduction to various contracts. This is a 1% reduction, and their portion of that is $500,000. What we were, when we took the 1% across all of the contracts, when we were taking cuts, our assumption is that anybody who's running a business can look at their contract and come up with 1% efficiency. It wasn't, we don't think they operate with a lot of fluff, but this was a way, again, to spread it widely enough to try to reduce impact. Going to go to adult forensic. That's the first one is item 26.7.5. It's a $250,000 cut. What we're doing is eliminating, we had 2 statewide evaluator positions. These are the evaluators that you hear a lot from the sheriffs about people with mental illness in their jails. People don't always have to come to the state hospital to get an evaluation. That's an expensive way to do evaluations. We're trying to reserve our hospital beds for people who require that level of care. So what we have in place are forensic evaluators who can actually go out to the jails, or for people with minor offenses, you can go out into the communities and do the evaluations that the court's ordering. These are 2 that had statewide capability. We could just deploy them wherever we needed them, in addition to who we already had assigned in that area. So if you had a spike in the number of people that needed evaluations in a particular area of the state, we would take these 2 and send them there. So this eliminates those 2 positions. We had also proposed in 26.7.6 is 2 diversion coordinators. What they were going to do is work with the courts. Judges are judges. They will use the resources you give them as long as they don't have to be the people that locate those. And so these were going to be people that worked with the local court systems. And when they had a consumer come through that had a mental illness or developmental disability, they would educate the court on what the alternatives were other than the state hospital that would allow them to use more of the community resources and not depend only on the hospital for lack of information about what's out there. We also took a cut of $95,000 in this area to eliminate the expansion of a telemedicine pilot. We are continuing, this was the pilot that we kept, we're continuing to pilot telemedicine in Macon. We think there's great potential in that area, and so we kept this single pilot because we want to evaluate the impact on transporting for sheriffs. And that's all in adult forensics. In adult mental health, item 26.8.5, the tracking document recommends in adult mental health that we take a $3.2 million cut in adult mental health. We're proposing a $1.7 million cut in adult mental health. We're proposing that $1 million be taken from core and specialty services across the state, our basic services throughout the state. We're proposing a $700,000 cut to supported employment. That leaves us with $150,000 in state funding for this purpose and $2.7 million in federal funding for this purpose. Those 2 combined will give you the 1.7 that we're proposing to cut in this area, as opposed to the 3.2. You'll see the $13 million in item 26.8.6 that are related to stimulus funding. 26.8.7 is the adult mental health portion of cutting the training and the compliance audits for providers. So that's $201,000 was their portion of that cut. In addition to that, 26.8.8 is another $107,000 that is combined with the above for a total of $308,000. 26.8.9 is to reduce funds for consumer and family assistance. They still have a balance of $508,000 for this purpose. 26.8.10 is a reduction in training. What we're giving up there, it's a $174,000 cut, and basically what we're giving up is we had a training program with the Medical College of Georgia where we trained psychiatrists in recovery principles, where you actually had people with mental illness working with psychiatrists on developing the skills from their perspective. That we had Network for the Improvement of Addiction Treatment training on retention and engagement, basically teaching providers on how to keep people coming in for the services that they need. We had recovery training that we were in a partnership with Yale University. About 100 staff members would have received training and technical assistance through this. Item 26.8.11 is another TANF reduction. It's a reduction of $1.2 million in federal funds. It eliminates job readiness training for about 150 consumers. $26.8.12 says reduce motor vehicle purchases. This is their portion of that. In adult mental health, it's a $157,000 cut. But again, we weren't buying vehicles. We were buying transportation for consumers to get to treatment. $26.8.13 is a $2.9 million cut to supported employment. Again, $150,000 in state funds and $2.7 million in federal funds continue to be available for this purpose. This is the reduction in funds for United Way Regional Commission. It's a $75,000 cut. 26.8.15 is we had an internship program for people with mental illness where they would be trained for employment with DHR. We were very proud of that program, but we're taking that as a cut, a $130,000 cut. We took 26.8.16, Family to Family. That's a program to train and support families of consumers with mental illness. It was only available in the metropolitan area, so we took that $100,000 as a cut. 26.8.17 is a centralized navigation website. It was that $240,000 we had set aside. We were going to develop a website where people across Georgia, no matter what county they were in, could go on the website, identify where they were at, find out the latest research. For instance, you have a young couple go to the hospital, and the hospital tells them that your child has Down syndrome. Then at this website, you would be able to access all the most recent information about that disability. You would know where all of the resources were that were close to you, all the national resources, and we wanted it on a very local level.
Were y'all doing that website in-house, or was that a outside project?
Our intent was to contract that out because there are a few that are recommended through the National Association of Mental Health Directors that they've tried them out and they've developed them in other states, so you know exactly what you're going to get and how much it would cost. So our intent was to contract it out.
So this hasn't been done?
No, we had not started, so we gave up that money.
Now, y'all got some kind of new web initiative, don't you, that's gave some kind of an award? Is that in your...
That's the Crisis and Access line. That's for people calling in for services.
Okay, I thought you had a web-based thing, too.
26.8.18 is reducing various contracts. That is that 1% reduction. This is the adult mental health portion of that 1% reduction across all contracts. 26.8.19 is one of the changes, and that is that change in the increased federal participation, $510,000. And then 26.8.45 is the adult mental health reduction to the crisis and access line. Adult nursing home, there were no changes there. Take you to child and adolescent addictive diseases, starting with item 26.11.5. That $22,500 is their portion of the cut to training and auditing. 26.11.8 is a reduction in core services. And this is child and adolescent addictive diseases. So this represents a 7% reduction in child and adolescent core services. It will affect about 259 consumers. We have a best practices model. The Clubhouse 2611.9 is we deferred expansion of that pilot program. So that was a $3.2 million cut. That, again, was a program where we have some of those up across the state. We were going to expand it, but because we had not brought them up and we were facing budget cuts, then we gave that up because it meant we didn't have to take children out of service. It was a service we had not started yet.
What'd you call that?
Clubhouse. That would have started, that amount of money would have served about 6 programs. We thought we would have been able to bring up about 6 more programs. 26.11.10 eliminates funding for a program with pardons and paroles. This is actually a fund source swap of $1.1 million. We closed 4 programs that were serving about 75 consumers in intensive outpatient substance abuse services. These people we're going to serve through our core services. The federal funds used for this services were transferred to child and adolescent addictive diseases services to fund a residential program for children. So this is just a fund source swap. 26.11.11 reduces funding for non-medical support services. This is $1 million of a $4 million cut. This is the addictive diseases portion of this. This impacts about, over a 6-month period, we generally expect to serve about 1,100 children. 26.11.12 is their portion of the cut to the crisis and access line, which is $40,000. And then 26.11.13 is their portion of the 1% reduction of contracts, which is another $100,000. 26.11.14 is the increased federal participation. And that finishes child and adolescent addictive diseases. Child and adolescent developmental disabilities, starting with 26.12.5. The recommendation here was that a $222,000 cut. We're proposing a $2 million cut. That wasn't an easy decision to make, but again, when we looked at the cuts that had been taken in addictive diseases and the cuts that had been taken in mental health, developmental disabilities was the least impacted. So I don't want you to think this was easy or that we didn't think that these services were needed. We're just trying to equalize the impact across all 3 disabilities. How we achieved that, Representative Manning, you asked about the Marcus Institute. This is a $1.1 million cut to the Marcus Institute. They still have, with this cut, $2 million in state funds, and they receive a $2 million federal match to that. So they still have $4 million. It eliminates $450,000 for the Matthew Reardon Center, which is in southeast Georgia. $450,000 to me. I know that this is all what rolls up to 26.12.5, where they say $222,000 cut, and we're recommending to you a $2 million cut in that area. And then there is a $468,000 in our recommendation cut to Emory University. That eliminates their contract. So basically we are giving up Marcus Institute, or a portion of Marcus Institute. We're giving up the Matthew Reardon Center contract, and we are giving up the Emory University contract to come up with the $2 million.
Okay, we have a question. Representative Mann.
So what's left for autism?
Marcus Center will have $4 million for autism.
Is that all?
That is the only contract that we have specifically for autism left.
In the state?
So this move would
In the
actually
state.
eliminate the Matthew Reardon contract.
This would eliminate the Matthew Reardon contract.
And it will cut Emory. I mean, it'll eliminate Emory too.
And it will eliminate the Emory contract
And half of Marcus.
and half of Marcus.
You got kind of lucky today with some of the missed attendance.
I'm telling you, I took note of that. But I'm sure it will not go unnoticed.
No.
But I want to be, you know, when you talk about children's services, any of them across the disabilities, there are no easy decisions. And again, one of the biggest criticisms this agency has gotten is that everything you do is in metropolitan Atlanta. You need to provide services. There's more to Georgia than Atlanta. And so we place a premium on anything that we put in place in rural Georgia and our core services, and that we have reached a point with our cuts, and I know you hear this from everybody, but we have reached a point with our cuts where our decisions are either take core services offline or begin looking at specialty contracts that you can let go of. And we're an area, I mean, we're a health care provider. We're an area where specialty contracts are not pork. Specialty contracts are what keep you cutting edge. And so we don't take it lightly that we're giving them up, and we certainly understand how important they are to the areas of the state where they're at. $26.12.6 is stimulus money. 26.12.7 is the reduction in training. This is the child and adolescent developmental disabilities portion of that. 26.12.8, this is new money to provide 150 waivers for money follows the person. 26.12.9, this is new money to annualize 365 waivers. 26.12.10 is to reduce 135 waivers. That's $572,000 reduction. 26.12.11 is a reduction, and this is the other portion to the Marcus Institute. 26.12.11 is a $500,000 reduction. That was the new money that they were supposed to get in 2009. But again, they're left with $2 million and with a $2 million federal match. 26.12.12 was a $200,000 cut to Matthew Reardon. That was their new FY09 money. 26.12.13 were state funds for a DD provider rate increase that were replaced. So that's $146,000. And then 26.12.14 is due to the increased federal participation. The next program area is child and adolescent forensic. And we did not, all of these things are the usual things you know about. We did not cut that. Child and adolescent mental health. I want to offer up to you, I realize that our budget is so involved. You can see where we went in and tried to take every savings that we could take, no matter how small it was, from different areas. So that gives me a lot of things to tell you that we've cut or changed. In child and adolescent mental health, starting with 26.14.5. The recommendation here was that we cut this area $751,000. We are proposing that we do not cut this area at all. 26.14.6 are stimulus funds. 26.14.7, yes.
And maybe somebody else from the department might want to answer this. Going through the budget yesterday with Commissioner Walker, I don't remember, and I could be wrong, but I don't remember us having near as much use of stimulus money in the other part of the budget as we do in mental health. Does anybody know what, I mean, is the stimulus money not available for anything else outside of mental health? I mean, because there's some very large chunks of money that are stimulus money that, you know, I go ahead and tell you, I have no faith we'll be here in 3 years. And we're going to have to come up with, right now, just as my quick math, and I'm not all that great sometimes with math, but I'm looking at about $50 million so far that I can think of, maybe $60 million, that stimulus money is replacing state money, that when that goes out, that money's gone. I mean, but I don't remember, I was flipping through a while ago just trying to refresh my memory, and I just don't see those big chunks being put anywhere else in DHR. Why is it being loaded up in mental health? Has anybody got an explanation on that? Is it the only thing it's available for?
Well, I think part of the problem was that...
Would you please approach the mic? Would you please
He's
approach the
asking you
mic?
to come up here to the mic.
As I understand it, part of the problem was that there weren't state monies to match on some of the requirements that were from the different divisions on the stimulus money. And that was why we couldn't use it in some other areas. That's my understanding of it.
Maybe we need to try a little harder to figure that out.
Okay.
I mean, because no. Yeah, in just a minute. I got a real uneasy feeling about this. I mean, I just,
Okay.
We're going to have another conversation about this. Actually, what I'd like you to do, would you please get to us, if you can have it to us by, well, no, actually, I need it by Monday.
Monday.
Because we're
Okay.
moving on this thing rather quickly. I need to know your stimulus plan.
Okay.
Where you're putting stimulus money by division or by program.
I think we have that.
It needs to be as specific as possible.
Okay.
I mean, you know, we can pick it out, but I want to, you know, we really need to know what
Sure.
you guys are doing, because we, you know, we're looking at 2010, but I don't think that way. I have to think 3 or 4 years down the road.
Right.
Because, you know, if I'm here, somebody else is here, somebody's going to have to fix this.
I understand.
Okay?
We'll get that to you.
Thank you.
Okay.
Oh, I'm sorry. Did you still have a question?
Well, I just wanted to figure out what the match was on the stimulus money.
We'll put that with the stimulus plan that we give you.
Okay.
26.14.7 is the portion of new provider training and audits. That's an $84,000 cut. 26.14.8 is the reduction in training. This is a $44,000 reduction for trauma training. So we're going to use federal funding only for this. This means that about 200,000 clinicians that we were training in this will not be trained. 200. 26.14.9 is just another portion of the cut to new provider training and quality audits. 26.14.10 is reduced funding for non-medical support services. The total reduction, combining this and child and adolescent addictive diseases, is $4 million.
Nope.
It'll impact about 1,100 children.
Refresh my memory again. What is that, the non-medical necessary community sports? What are we talking about?
Those are the kind of things that children require that are not medically necessary, but are necessary if you're going to have a healthy child. After school programming, tutoring, things that a provider might offer. You may come in for therapy, and then there's an after-school program coupled with that. 26.14.11 is a change. It's a $4 million change. What we are doing is taking our state outdoor therapeutic programs for children, and we're starting to bill people for placing children there. If DFACS wants to purchase a bed on behalf of a child, then we bill them for it. If a family wants to purchase a bed, then we bill them for it, as opposed to it being totally funded with state dollars. 26.14.12, again, is the portion of the motor vehicle purchases. That's transportation. 26.14.13 is the transition of residential services, and we're taking a cut here, and what we are doing, again, is beginning to bill people for the services that we're providing. 26.14.14 is elimination of the Medicaid rate increase. That's a $3 million reduction. 26.14.15, we were proposing to put a crisis stabilization program in Rome for children. It didn't open. We contracted with a community service board, and they're now providing that service for us on the grounds of the hospital, so that's a $723,000 cut. 26.14.16 is a reduction in the United Way contract that we've already talked about. This is just the child and adolescent portion. 26.14.7 is we elected not to expand the summer recreation program. 26.14.18 is their portion of the cut to the crisis and access line. 26.14.19 is replacing funding for 4 child and adolescent transition homes that we had. Again, when we provide residential programs now, we're billing other agencies who are accessing those resources from us. 26.14.20 is just the 1% reduction to their contracts. It's a $100,000 cut. And then 26.14.21 is just the increased federal participation.
I have a question. Representative Hinson, if you could pull your mic down so it can pick it up.
If you have, we're billing the care management organizations now that provide behavioral health coverage for children.
That was it. You got it.
We bill DFACS when they use one of our beds. If any family wanted to use our program, then we have the ability to bill them for that bed space, that treatment program for their child.
And what are we having to put in place? Because this sounds like a pretty onerous type billing system, because you're going to have lots of individuals. One, how are we putting it in place? Do we need additional personnel? And what happens when an individual who uses your services for their child cannot pay? Is their child deprived of future? Are we going to penalize that person? Do we have punitive damages? I mean, how are we approaching this?
Actually, children that go into outdoor therapeutic programs, that's not a quick turnaround for children. So they're there for some few months. So it's not like a large volume of children coming through that you have to bill for. So the billing has not been an issue for the outdoor therapeutic programs. We always we consider ourselves the mental health system for not only foster children, but for children who don't have insurance. And so we reserve a certain portion of our state funds to cover those children who don't have insurance or the ability to pay. And so we would not reject a child because they did not have the ability to pay.
And one last thing, when we talk about the summer programs for children with severe emotional disturbances. Now, I know Truett Cathy has some program he's put together, and I'm sorry for not knowing what type of child he's addressing in his program, but I mean, are there particular programs? Are we eliminating it? Is this something that's really beneficial for the child, and that the children won't have anything that as an outlet that they can have?
Which, are you referring to a particular item?
26.14.17.
Okay. 26.14.17 is the summer recreation program. These are programs that we typically contract with community service boards to provide for recreation activities. Children with severe emotional disturbance don't always incorporate well into regular recreation programs, say, that are offered by your community recreation center. And so either CSBs provide those, or they provide a companion to go with the child to help provide the extra support. But I am familiar with Truett Cathy's program, the WindShape program. He takes children. He does not take children who are delinquent children. His are children that he feels like have great potential. So he does a good job with a different population.
Thank you.
The only area that we have left is direct care and support. And the only item in here is 26.18.5. Well, there are two items. 26.18.5, that's the motor vehicle purchase, again, that we use to buy transportation. And then 26.18.6 is the increased federal participation. Just for the sake of you understanding what that area is, direct care and support in a hospital are those things that cross all disabilities, your therapies, all those type things where they serve multiple disabilities in the hospitals. And I'll be happy to answer any questions you may have. I know this has been lengthy.
No, actually, it's been rather impressive, actually. Even though I have not enjoyed what you've said, I have enjoyed it how you've laid it out there. Very detailed. I want to congratulate you on that. It's probably one of the most detailed presentations I've received yet, as far as good explanations of where it's going. I don't like some of what's going on. I'm starting to see a pattern develop. But I do have a few questions. This has more to do with kind of the structure of mental health right now. You have some regional offices or regional boards. Could you give us a brief explanation of how that system works?
Well, you actually have two things. You have regional offices. We have 5 regions, just like Department of Juvenile Justice has regions and DFACS has regions. We have 5 regions. Each of those regions has an office in it made up of our staff. And they are the face of MHDDAD in their community. I mean, basically speaking, everybody doesn't want to drive to Atlanta when they have a concern about our system. For instance, we have an office in Rome. We have an office in Tucker for the metropolitan area. We have one in Columbus. We have one in Albany, and we have one in Savannah. And so in those regions, they work with families. They cover all 3 disability areas in both children and adults. And they make sure that the contracts that are in their area are in place. They work with the providers on developing capacity where we need it, help make sure bills are paid, and give families a place to go to. The other area that you may be referring to is by law, there are regional planning boards. And the regional planning boards are made up of people who are appointed by their county commissioners. And they come together and provide planning, local planning, that they contribute to us to develop our state plan so that all 5 areas are reflected in our state plan.
Okay. Are there state dollars involved in that last bit?
That last bit, there's not a lot other than the fact we may reimburse some travel or something small like that, but they're not paid. They're all volunteers, very little money. The regional, our staff, obviously, there are costs associated with that at our regional offices.
Okay. I have a question from Representative Manning.
So after we get all this stuff in plan, what do we have left for transportation and training for the state?
In training, give me just a minute. We kept, which item? Help me find that, Deanna. It says in training, about a 20% cut. So we've got 80% capacity left.
That's statewide?
Mm-hmm.
That varies from program to program.
Yeah.
And our transportation?
Our transportation,
I think approximately $1.5 million in state dollars, but a lot of our transportation is in federal funds.
so 1.5 in state, plus our federal funds, block grant funds that we use for that purpose.
Do you have a number?
We can get you a number. We can give you a little workup on what's left in transportation and how we're using it.
And one more, if I might.
Mm-hmm.
What have we got left in oral health?
Nothing. However, we do have dental clinics at some of our hospitals. The difference was with oral health care is that not a lot of money, but this person was out there working with dental schools to get dental hygienists comfortable with serving people with developmental disabilities so that they could get services in their community instead of having to come to our state hospitals. Families drive a long way to bring their child because often it requires sedation or restraint, and your general dentist is reluctant to provide
And
those
the number
services.
of extractions, oral health is a real big problem with this kind of population.
It is one of the biggest problems that we have in the area of developmental disabilities.
I understand.
I would offer to you on transportation, it's a legitimate concern. The reason, not only because the consumer can't get to services if we don't have transportation dollars, but it puts our providers at risk because, particularly in terms of children, if you're in a fee-for-service environment and nobody comes in for services, then you can't bill. And so if people aren't able to get in for services, then you can't bill for them. And that has an impact not only on the consumer, but it has an impact on the provider community.
I guess I've got so many questions I can't think which ones to ask. I'll let Representative Henson go first.
Thank you. I think I'm going to follow up on Judy's questions and comments about the oral health. But somewhere and somehow, our departments that treat the health of our children and our adults in this state have got to get away from a silo mentality and looking at, we don't need this part. The oral health is so critical to the overall health of an individual. I understand the difficulties with the developmental disabilities. My ex-husband's a dentist. His son is autistic. So I've seen it. I've been there. And we're fortunate, very, very fortunate. And I know how difficult it can be with just a child, let alone a child with developmental disabilities. It really and truly can. But that's what's going to help create the healthier child and to keep that child healthier. The infections, the problems that occur, even to the eating habits and all, it's all there. Somewhere we've got to find the money, and we have to do some kind of priority. This isn't a lecture to your department. It's all over. But, to be able to prioritize oral health care, because that is so integral to the overall health of an individual.
I agree.
Okay, well, I'm not dragging the meeting out any longer. We're going to send you a list of some things we need information on. But after going over both budgets, I think I've got a pretty clear memory of yesterday. It seems like it looks like mental health. It looks like your part of this deal got kind of heavily targeted in the cuts. I don't remember us rattling off some of the big numbers that we rattled off yesterday. I have some grave concerns. I mean, we're under the gun right now. We're being looked at, investigated by the feds, and it seems the place that where we need to be holding on the strongest, we're knocking off the most. But we got a lot of work to do. Take a look at this and see if we can't come up with some better ways to do that. And I want you to give me as much input as you possibly can on some of the things we might can do differently, and try to minimize the pain on this. Representative Manning, do you have?
I'm waiting for you to get through.
Go ahead. I'm pretty well much done.
There was one other area that I don't think we touched on very much, and that is the pharmacy, being able to treat these children with meds and have some sort of uniformity. And since Representative Carter's not here, I feel compelled to at least bring it up. Do you have any kind of recommendations that we might be able to find some place to do some uniformity in our formulary just because we're going to get sued?
We have, we protected pharmacy. That's one of our core services. So we protected it to the extent possible. Whenever you take a cut out of core services for children, then pharmacy is that. But it's so critical to the treatment of both children and adults with mental illness that is like the last thing that we give up. So it's a fairly protected area for us.
Okay, any other questions from the committee? Okay. All right, well, I want to thank you for
Thank you.
The way you presented the budget. You did an excellent job. And with that, I'm going to adjourn the meeting. And however, if anybody's interested, my wonderfully talented niece will be singing at the Capitol on the MLK side today at 12:30. She may be a future American Idol contestant.
Don't you hope? That's great. Are you going to ask just some general